I've been working at Butler's dietary department for the last 7 years. I just got a new job as a mental health worker, so next week I'll start training on the inpatient units. I am very concerned about the lack of PPE that Butler Hospital is providing to staff. We get the numbers every day of the specific counts of PPE that they have. We know that there's more than enough N95 masks for everybody who has not yet been fit tested for one. And the kind of departments and workers that they're looking over are housekeeping, our environmental services, dietary, social workers, clerical staff. And, in some of these departments, like housekeeping in particular, a lot of the staff are older. English is their second language. They live with vulnerable relatives. And, people are really terrified to come to work right now. We have 6 positive staff. I think there's about 9 who are awaiting test results right now, a number of positive patients. And, the hospital saying that they don't want to fit test those extra people to save their supply really just doesn't make sense to us given what's happening. If you're waiting for the surge is coming right now. We're only 2 weeks away from our projected peak in this state, and people are already dropping. And in addition to that, we have staff who are out on leaves of absence right now who would like to come back to work, but they can't because they don't feel protected. And this affects me on a personal level now that I'm going to be doing direct care on the patient units. I myself am HIV positive. I had to go out and I'm immunocompromised, and if I were to get sick, it could potentially be much worse than for an average person. And I had to go out and spend half a paycheck on my own private stock of N95s because of the fact that I work in dietary, and the hospital, they call us essential, but to them our safety is not essential. So I think that's the message we want to send today, is fit test everybody, because everybody's safety is equally important here, especially in a congregate setting like Butler. Our units are set up milieu style, so the patients are always interacting, touching a lot of common areas. It's kind of just like you see on TV, And it's the same elevated risk level as a nursing home. And look what's happening in our nursing homes right now. That's what we're hoping to prevent here at Butler. So that's why we're out here caravanning today.